The assumption health is expensive seems correct because if you fall ill, we can spend very deeply just to be back to health. Therefore, before getting sick, it is better if we prevent or at least detect early health problems that may occur so that the risk of various complications is reduced. One way that can be done to detect early is physical examination. Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, I'm Nurse Fitri. I want to tell you about the importance of physical examination. A physical examination is a routine test performed by medical professionals examining your overall health. A physical examination can help you find out your health status. This examination is required by anyone, both women, men, young, and old. Even people who appear in good health need to do a physical examination. Why a physical examination is so important? First, a physical examination is carried out in the framework of early prevention and anticipation for future health. Second, a physical examination helps manage and maintain a healthy lifestyle. Third, a physical examination can save your money. Fourth, through a physical examination, you will receive professional advice regarding a medical diagnosis and treatment recommendation for better health. Here are some examples of physical examination is neck assessment and head assessment. We are going to the neck assessment. First, so you're gonna have the patient extend the neck up a little bit and looking at that trachea is it midline, look for any lesion and any lumps like what you might see anterior problems like a girder, and I don't see any of that. Then what we are gonna test cranial nerve 11, which is the accessory nerve, so being what I'm gonna how her do is move her head side to side, up and down, and then try to shrug against my resistance, and her does that with ease so that nerve is intact. Then we are gonna place her at 45-degree angle, and we are gonna have her turn his head to the side. And what we are looking at is the jugular vein. We are looking for any jugular vein distension, and we are looking for any distinction of the vein, and I don't see any. Next, we are gonna palpate the trachea just to confirm it is midline and I don't feel any lumps. Next, we are going to palpate the lymph nodes, all sides of those, and I didn't feel anything and no tenderness. Finally, we are gonna palpate the carotid artery, and this is one artery that you don't palpate bilaterally. Second, we are going to the head assessment. So, we are first going to inspect the head and we are looking at the skin color. We are also going to make sure that the head is the same size. Next, what we are gonna palpate the head, the cranium. We are gonna check for any masses, indentations, look for skin breakdown, any infestations. Okay, that's an example of a physical exam. Routine health detection is very important because a person doesn't know when the disease will come. The ideal age for a physical examination is, of course, as early as possible, or if you have symptoms of a disease. Let's detect the health of your body early by doing a physical examination. Take care of your health and don't forget my message. For healthy, you are perfect.